Welcome to this workshop. My name is Rajesh Tandon. I'm founder president of PRIA, Participatory Research in Asia, based here in New Delhi. I am also UNESCO co-chair in community-based research and social responsibility in higher education. We have been partnering with many initiatives arising out of the European Union's perspective on responsible research and innovation. And one of those partnerships we have is with a RRING initiative, which is Responsible Research and Innovation Networking Globally. As part of this initiative, where UNESCO itself is a partner, we have planned earlier a face-to-face, but now a virtual workshop on the recommendations on science and scientific researchers, which were agreed to by 195 members nations of UNESCO in 2017. As last 4 months have demonstrated, not only in India, but around the world, people in the societies, people in the communities have suddenly started noticing scientists. They have started noticing scientists because the pandemic has raised hopes that scientists and science will provide quick remedies to restrict infections of coronavirus, and the COVID-19 spread will be halted. All of us have been receiving various kinds of messages, information, some from the science community directly, some from our officials and ministers, and some from science communicators. So this afternoon, we have an opportunity between now and 5:30 p.m. to have a conversation about these recommendations, which have been agreed to 4 years ago, and what are the implications of those recommendations in the context of what we are experiencing, what we are witnessing, not in all our countries, but more directly in India. We have an excellent panel this afternoon. I will introduce all of them quickly and then invite them and introduce them again. Our partnership with UNESCO Delhi office, we are delighted to have Mr. Juan Pablo Ramirez Miranda, who is head of the section on human and social sciences. And Juan Pablo will give us an opening presentation about what these recommendations entail, what's the message, and how did they come about, and what needs to be followed up from now on. Then we have, after his presentation, we will have 3 panelists. We have Dr. Anand Krishnan, who is a very well-known professor of community medicine, researcher, based here in All India Institute of Medical Sciences in New Delhi. And he has himself been involved in hands-on in many ways in dealing with this pandemic and its implications on our people. We then have Dr. Rashmi Rodriguez, who is assistant professor of community medicine based in St. John's Medical College in Bengaluru. Dr. Rashmi will also share her perspectives. Perspectives from Bengaluru sometimes differ from perspectives from Delhi. And so welcome, Dr. Rashmi. And then our third panelist, of course, is a very well-known science communicator in India, internationally acclaimed, Mr. Dinesh Sharma, who has been founder of India Wire Service. And, you know, if you are interested in science, you will come across Dinesh's writings and communications regularly. So that's our excellent panel. And let me just give you a little bit of Zoom instruction. By now, I think 100 million people in India are Zoom expert, but in any case, you know, we after the presentation and the comments from our panelists, we will then open up for your own questions, comments, observations and you can use, there is a Q&A section where you can write your questions. Some of our panelists may even answer them in writing online as they go along. Please don't use the chat box, because the chat box we use for communication among me as a moderator and my fellow panelists. That helps us. I may have to periodically tell them to stop or to say more, or would you answer this question? So leave that chat box for me. So once again, welcome all of you. And without any further ado, let me invite Juan Pablo Ramirez Miranda, the head of the Human and Social Science Division of UNESCO, based here in New Delhi. Juan Pablo.
Thank you very much, dear Professor Tandon. I will try to be very mindful of the time you have allotted for my presentation, but of course I have to take a couple of seconds or even my first minutes to thank you and PRIA for the organization of this online workshop at a very timely moment where we are going through a global pandemic that has evolved in many different ways, but where we have not even begun to be able to measure the socioeconomic impact of the pandemic. So, of course, all of these impacts will be overarching across all areas and aspects of our societies. But as you say, it is one of the key aspects that are at the center of our attention right now is science and scientific researchers. I would also, of course, like to recognize UNESCO's important partnership as member of the RRING program with the European Union, and of course, PRIA and UNESCO as long-standing partners on this and many other issues. We are delighted to welcome all of the participants to this forum. Right now, we have over 50, and I'm sure more people will be joining along the way, and obviously looking at this recording later. So I say hello to all of you, and I hope you are all staying safe and well wherever you are and whenever you are watching this. And I obviously also say that I'm delighted to share this forum with the panelists. If you allow me, I will now share my screen to begin my presentation with the PowerPoint. So, of course, as part of this workshop, what we are here to discuss is the UNESCO recommendation on science and scientific researchers for 2017. We all know that the right to science is enshrined in the Universal Declaration of Human Rights. So, of course, this is a long-standing international agreement where all signatory countries of the Universal Declaration of Human Rights have already defined that science and having access to science is one of our universal, indivisible, and permanent human rights. But UNESCO, as the specialized agency of the United Nations on education, science, and culture, is in charge of, let's say, the international cooperation on issues related to natural science and, of course, social and human sciences. Since 1974, there was a global agreement on a previous standard, global standard instrument that was focused on scientific researchers. But at the time, it was adopted with somewhat a limited scope. After 40 years of negotiations and the evolution of our societies and the global community on these aspects, in 2017, as Dr. Tandon was saying, the UNESCO recommendation on science and scientific researchers was adopted by 195 countries at the UNESCO General Conference. This, of course, marks before and after for having a reference on a global standard on how governments, and within governments, of course, societies and concerned stakeholders should undertake the development of science and particularly their approach from policy to practice to scientific researchers. In any sense, this was very good news for the scientific community, and I must say for societies as a whole. And what we are here to discuss, of course, is how this recommendation is implemented and how it's monitored, because each national government is required to produce a report on how they are translating the recommendation into their own standards and system of science in light of the recommendation. The first edition of this report, the recommendation was only adopted in 2017, so the first monitoring process has just been launched, inviting all of these 195 countries and 193 UNESCO member states to produce a report on how they are advancing with this recommendation. And the report needs to be submitted to us by March 31st, 2021. Of course, it should outline the main features of the Indian research environment, its strengths, and its weaknesses. During these difficult times, of course, and especially because of these difficult times, we need to be fully aware of the rights and also the responsibilities of scientific community. And this standard, this global standard instrument, of course, provides the right framework for us to address these issues. And I trust that not only my fellow panelists and all the members of the RRING consortium, but all the participants and interested stakeholders to this online workshop will join us in supporting scientific researchers and help to promote this text of the recommendation to make it better known to the scientific communities and all those concerned. In a nutshell, because of course I invite you all to go through the full text of the recommendation. The recommendation is structured around 10 key areas. And these are right now shown on the screen. But of course, it is very important to note that this recommendation ensures that the freedoms and responsibilities of scientists are widely recognized. It stresses also the importance of open science and the role of science in public policy. This is something that it's very crucial in a time like the one we're living, where science will provide some of the responses we are all waiting for. The recommendation also explicitly identifies human rights concerns related to research and ethical dilemmas. And particularly, of course, it has a focus on women and girls to encourage them in scientific careers and promote gender equality. It also promotes the access to scientific knowledge and a satisfactory research environment. Of course, the Indian government and the general public need to consider the value of science and technology to tackle global challenges, and implementing this recommendation and all of its aspects and the key areas is certainly important. Science is now a major preoccupation with high expectancies, and it has a lot of challenges and a lot of successes. Without science, the tests, for example, for the detecting the virus or antibodies would not exist. We would not be able to find efficient drugs against the disease. And all of these examples allow us to see that careers in science need to be encouraged, and that scientists need to be fully recognized for their achievements within societies. So all governments across the world should use scientific knowledge produced by researchers in a responsible and accountable manner to inform the national policy and decision-making. These type of concerns are the ones put forward in this global agreement. So public health has to be strongly directed by these issues, for example. Right now, public health is a major concern, and these recommendations can drive how we translate into practice public health concerns. The role of science in the national policy and decision-making, international cooperation and development cannot be neglected, especially during a pandemic. Science should benefit from adequate public funding and be recognized as a common good. And that is one of the key issues related to this global standard, serving long-term and public interest. Right now, it's impressive how now it's extremely transparent. When we talk about science as something that contributes to common good and public interest, it's very, very transparent to us because we are going through this pandemic. So Of course, the recommendation also establishes that research should be conducted in a responsible manner that respects human rights of scientific researchers and human research subjects, particularly as relates to testing protocols. For instance, even if processes leading to the elaboration of vaccines right now are accelerated, we need to keep the highest international standards who are advancing our knowledge in the fight against COVID-19. And so these standards are not only a gauge of respect towards human rights, but also a gauge that experimentations will take place in relatively similar conditions. Member states should support ethic guidelines and committees, along with education and training. This is intrinsically linked to science. Conflicts of interest also have to be acknowledged. Recognizing them is now a global standard part of the recommendation. And this increases the accountability and transparency of the scientific process. Science needs to be as immune as possible for all of these controversies, to provide clear facts for policy making and for the general population, especially in times of crisis. So all of these standards have been agreed, and I hope after this brief presentation, I am conveying the enthusiasm of having such a global standard agreed by the international community, being such good news and important for us. And of course, the discussion that will follow and the important thing to do is how we can support the translation of this global standard that right now is on paper into concrete action and reality. The result would be to achieve a positive environment for science, providing more inclusive working conditions and tackling inequalities regarding access to education and employment is crucial along the way for the strengthening of the scientific environment as a whole. Of course, this entails that all Indian citizens should enjoy equal opportunities for education and training. Equal access to employment in scientific research should also be guaranteed, including the promotion of diversity and gender equality. We will also, by this, be able to collect insights from individuals with different points of view. And that this might lead to the government better understanding the context in which some communities evolve and to policy adjustments leading to a better response against the pandemic. A positive working environment is also an environment in which public accountability and responsibility are well respected. Scientific researchers, of course, have to respect these values while still enjoying a degree of autonomy and intellectual freedom. All of these concepts that sound very philosophical and that sound as ethical standards are embedded into this recommendation. And freedom also means open access to research results and the possibility to share scientific advancements within peers. That is why the issue of open access is still considered with this. And it's important to keep as part of the discussion. UNESCO is actually in the middle of another specific development of another standard on open science. I mean, but it's very important to know that the standards are already on open science are already embedded as part of this overall international agreement related to science and scientific researchers. Throughout 2020 then, member states are expected to prepare their first report on implementation, assessing the situation of science system on several difficult to measure issues. For instance, how much freedom do scientists have to advise the government for policymaking and other issues? How well do schools offer STEM education inclusively and without discrimination of any kind? Is research conducted responsibly? Of course, that is a core question too. All of these questions are part of what needs to be interrogated when drafting this report. This is one of the first times where the government is asked to look closely at the conditions of scientific researchers and make comparisons with other countries, because that is what this will allow. This is the first report, so we will have, number one, a baseline for future exercises that each member state can compare their progress. And number two, it will allow for comparisons and for sharing lessons and experiences with other countries. This assessment is an opportunity for the government to do a checkup and gather information for making the best public policy choices. The report has to contain quantitative and qualitative indicators, making it a chance to understand the strength and the weaknesses of the Indian science system. Consultations, of course, with stakeholders from the public and private research sectors are encouraged as part of this process. So all concerned stakeholders should also, from their end, like as part of the civil society and the scientific community, promote this process and approach the government to try to support and for their voices and considerations to be included. This is the roadmap for the report. It's just a classical with consultations, leading to probably a workshop with where the government and everyone concerned will be available to discuss. Contributions then are gathered, compiled into a national report, and then a consolidated global version relying on all the reports from all countries will be published. In conclusion, research is essential and more than ever during the pandemic. However, researchers need to be adequately managed by scientists able to enjoy a scientific degree of freedom while being aware of their responsibilities. The government should therefore work in favor of the complete application of UNESCO recommendations. That is what we advocate for as part of our own mandate given by governments themselves, to develop the best and the most available scientific knowledge in response to this current crisis, because as we know, all of these effects are just the exacerbation of the systemic issues that were there to begin with. With this, I have not gone past 16 minutes, and I thank you very much for your attention.
Thank you very much, Juan Pablo, for excellent summary and overview. Obviously, as you said, we can all read more details on the UNESCO websites and documents, but this has been very helpful in focusing our attention on this. Let me now move on and invite Dr. Anand Krishnan, who is a professor and Center for Community Medicine in All India Institute of Medical Sciences, based here in New Delhi. Dr. Anand Krishnan, please.
Thank you, Dr. Tandon, for inviting me to this webinar. The topic is very vast and vague in a way. I will try to bring some of my thoughts on what has been presented. Largely, we looked at the 10 points, the thing which can be divided into conducting science, managing science, and using science. That's the three ways that I'm trying to. The 10 points conducting science would include the ethics and conflicts of interest and those kind of things. Managing science would be the enabling environment, human capital, funding, and finally using science. How do we use the science for policy making and decisions? Interestingly, I was involved last year with WHO in developing a health research capacity assessment tools. In a way, we developed a tool which can be scored from 0 to 100 to assess the capacities of countries to do health research. It yet to be validated and all, but we developed a tool with consultation with member states, and it addresses most of these issues, including the stewardships and governance issue, capacity, oversight issues, and the use, outcome, and translational aspects of it. So, but frankly speaking, and it's my ignorance that when I was doing that work, I actually did not know much about UNESCO. In a way, one of the problems also is that the health and social sciences are in different baskets of research, which often have, even though some people might be doing both, but I'm frankly not that much exposed to the social sciences aspects of the declaration and all. I more come from a largely health sciences background, and that is that bridge needs to be, that gap needs to be bridged better for us to be part of this discussion. So having said that, let me look at some of the issues that has been raised and share my thoughts on them. The first is the issue of role of science or scientists, especially with respect to the current context of COVID. We all know that scientists are in the center of the glare during the current controversy or current pandemic, and often in a more controversial manner than in a positive manner, let me put it. Is it, can we conclude that obviously many people can also claim that scientists and science have been the sort of saviors or hero of the occasion, though I would put them as a more shades of gray rather than a typical Bollywood of hero villain. I would put it that they are more of character actors in this whole scenario. But if you ask me, see, when science by definition is even though we think science gives you one answer, most of us who are in science know that science gives multiple answers. There are no one answers to many of the questions that we ask. The fact that we expect scientists to give one single answer is itself a wrong premise that we work with. And scientists are actually comfortable with uncertainties. We work with uncertainties. We are aware that everything is not black and white. There are lots of gray areas. And we are tuned to work like that. But most public and even policymakers want very clear answers. That is, it may simply be not possible for scientists to do. I'm not saying scientists don't make mistakes. They make mistakes. They are human beings. They make mistakes. That is, but in very often, science does not have an answer at this point of time. And scientists, the current evidence is not sufficient to advocate any line of action. It could be hydroxychloroquine or mask or a lot of issues which came up. Science was at that point of time incapable of giving you an answer. There is nothing wrong with it. Science does not have answers for many questions. As things evolve, we might have better answers. It only makes us strive towards a better answer those questions. So in a way, and I think modeling is another example of how science in a way has failed. The results of models, including today, when we saw today of about 3 lakhs cases a day. There are a lot of caveats in that, but those caveats are never noticed when you communicate. And I'm sure Dinesh will talk about that. Nobody is going to look at the caveats in a paper which says 3 lakh cases a day in 2021. And one of the problems or issues is that this time, because of the advance in technology, science has become accessible to everybody. But interpreting science is not that easy. So while making access to science much easier because of the technology, interpreting science is a much more difficult, and most people lack even basic sense of interpretation, forget more advanced sense of interpretation. As a result, what is happening is that the science is being seen as failure, whereas it's actually not truly a correct interpretation of or scientists. It is because people have not understood the science or the scientists what they're saying and interpret it in their own way based on their own experience. Those are not the true interpretations. Again, there have been many scientists also who have done these kind of mistakes. It's not that I'm not saying that scientists have not. So that is one issue when we need to discuss. The other issue is the institutional mechanisms for using science. They're largely personal, but especially in the Indian context, if you want, let us be very clear, scientists speak, as I said, different language. Policymakers and public speak very different language, and scientists don't know their language, they don't know our language. So I am saying that they have failed to interpret science correctly. They have every right to say that scientists have failed to communicate correctly. I think their point is also perfectly valid. And therefore, we need to have mechanisms by which a better dialogue can occur at an institutional context, not an individual context. Again, we have, in some ways, these institutional mechanisms are not there in many developing countries, including in India. In this context, Niti Aayog or ICMR or NCDC, in a way, have failed in a proper communication, both to policymakers and the public. And I'm sure Dinesh will also talk about risk communications. There have been clearly failures of risk communication in this, as we have done it n times in the past, including SARS, and every time such a pandemic comes, even in a smaller, we fail in communicating risks to people. Risk is a much more complex. For example, there is a lot of controversy occurring on airborne transmission of versus aerosol. It seems to be a very big thing, but that fact by per se does not affect risk for an individual. So before you interpret that piece of evidence to say that risk of individuals, there are a lot of things have to be taken into account. The fact that virus is transmitted airborne, how does it affect risk for individuals? That is what we are interested in. It's a much more complex process. So nobody has gone into that. So I think we need to have better communication. We need to have better institutional mechanisms for communications. Finally, is the issue of two issues I would like to talk. One is on data sharing and accountability issues. Obviously, data sharing is a very important issue. And again, we are not doing very well on that aspect. For example, somebody told me even gender-wise data of COVID is not available. Are men more affected than women? Some basic information. We are not asking about more detail. So some basic information on data and much more. So while protecting privacy, at the same time, a better use of data and better sharing of data is required. We need to have to put in place mechanisms for improving our data sharing. Finally, is the issue of funding and research prioritization. Research prioritization is obviously important. We don't have enough funds to do everything we want to do. But the process of research prioritization and largely when we research prioritize, we go for more clinical and more basic sciences. Social sciences usually gets neglected in many of these research prioritization. Inequities is one of the core component of public health, but it is something that is almost never there a part of a research prioritization exercise. And funding is obviously an issue, and funding almost drives the research prioritization. We need to have not only better funding, but also more equitous funding of different aspects. And last comment on the ranking exercise. As I said, I developed a tool for WHO for ranking, but I think those when we go for an international comparisons, I'm not necessarily, and I'm not really a great fan for international comparisons between countries of, I think this kind of assessments are more for within country context and within country use rather than making international comparisons. I am not a great fan for international comparisons. I think they are not necessarily very useful. I understand that agencies like WHO and UN, they have to make such kind of comparisons, but I would push and make a case for more within country use of these kind of measurement tools than between country. Thank you, Dr. Tandon.
Thank you very much, Dr. Anand Krishnan. Very thoughtful comments, both from the point of view of scientists, but also public at large, and how science prioritization happens. Thank you very much. We'll come back to some of these issues later. Let me now invite Dr. Rashmi Rodriguez. Dr. Rashmi is Associate Professor, Department of Community Health in St. John's Medical College in Bangalore. Dr. Rashmi, floor is yours.
To start with, thank you very much, Dr. Tandon, for inviting me for this discussion. So I will briefly go through open science, maybe, and refresh the participants' views on open science, open publishing, and then go into briefly regarding the COVID pandemic and open science. So just to start with, open science, well, we all know that it comprises of three important components, and one is open data, open access, and then, of course, open source. So the presentation will kind of revolve around these issues. And if we look at open science and the taxonomy of open science, we see that it seems quite a large and complex web. Well, initially, I just thought it was rather a simple topic, and that maybe it's just open science and open publication, and what much can we really think about open science. But when I looked at this tree of open science taxonomy, and then I was quite amazed to find how it has branched out into different components at different levels. So, well, open science while it's those three components, there are several aspects to those components at various levels. So we have from open access to open data, we have open reproducible research, open science evaluation, open science policies, and open science tools. And I think if each of us were to dwell deeper into this, a lot of components of these different aspects could be included into our discussions and policies. However, we will primarily first look at open access models. So, which we are, I think, most familiar with. We're always talking of which journal we want to publish our articles in, whether those journals are open access, whether we have to pay for those journals. And if we look at open access models over time, they have evolved. And we have moved from closed models to a gold publishing model where open access journals are indexed by the directory of open access and are available to all free of cost. Of course, then we have the green, which are tall access, and of course, there is, it's on the publisher page, but there is a free copy in an OA repository. So if you look at what has happened over time, you will notice that most of the publications and views have moved from the bronze, closed and bronze category actually, to the green, the yellow and the gold category, if you see. So, and this is the path forward, and this is where we are, what we are going towards. If we look at it a little further and we look at the workflow, there is now a concept of preprint, which didn't exist just a few years ago. Then, of course, you submit it to a journal, there's a peer review that happens, there is a postprint, and of course, there's a published version. So, and these, I mean, depending on the journal that you choose, there may be embargoes on what you can, whether you have access to, or whether you have permission rather to preprint or not, and different kind of things. So if we look at preprints, even they have, what shall I say, improved, or I mean, the numbers of preprints have increased markedly between 2014 and 2018, and now in 2020. I mean, even I myself have ended up publishing preprints. Recently, I've had like 2 preprints of late before peer review. So it's kind of, actually, initially I was quite hesitant about putting articles in preprint, but with time and understanding of several different things, we also realized that preprints have a certain value. Though you cannot absolutely use it as evidence, it still gives some information about the research that you have done, and it is of some value to society. If we move further and look at the barriers to open access, and what exactly are we looking at here when we talk about open access? Of course, there are policy or legal blocks, which maybe several times political, you can publish, cannot, depending on national policies. You have economic issues, of course, and we, as especially from the time I remember being a lecturer to an assistant professor and associate professor, I've realized that it's not very easy to publish in high-end journals, as you may call them. So it's been difficult, and there have been times when I have requested journals to waive off fees. Sometimes I get a response that says, we cannot waive off fees to Indians because they are, it's a middle income setting. So we do not provide you with that, with that privilege. And that becomes an issue because there are several Indian researchers and doctors, especially working in the medical field. They may be working in NGO settings and other settings. They work for a nominal fee. In fact, the organizations they work for are charitable organizations. And then you have this, we cannot really waive off your fee because you are in a middle income setting. And I have this mind so many times to turn around and say, if I were to publish even 2 or 3 articles, maybe giving you literally half or even 3/4 of my salary. And that's really hard to come by. And I think it's really hard for people who decide on these policies of waiving off fees or charging to understand, especially when they are based in high income settings. Of course, then you have this academic community's knowledge and attitudes towards OA. And this, in my experience, even in the Indian context, we still, when we apply for research grants, give a list of our articles and give also alongside kind of give the impact factor for which where the articles were published, for the journals that the articles were published in. And that, I think, I mean, and of course there are several drawbacks of the impact factor. And even if you are the 4th or 5th author in a particular paper, it might still increase your, what shall I say, the impact factor may be so high that it might just overtake most of the other applicants in a way. And then the question is how valid is it really if we are looking at impact factors and dishing out grants to people, rather than maybe their experience and maybe, of course, the quality of the research after we have read their publications. That's something perhaps that we actually need to focus on. Then we have academic culture, and of course here I have another important experience. So as a faculty at a medical college, we kind of go toward, we have regular Medical Council of India inspections. And at these inspections, we generally ask the questions, of course, of late especially, is this an article that has been published in a printed journal or is it online? They do not really go into other aspects. And if it's a printed journal, it's fine. But if it's a journal that publishes only online, then of course there is a problem. And it could, even if the institution has given you a promotion, the MCI may just say, no, we cannot accept this promotion because your articles are published online and not in journals that are in print formats. So these are issues that we have come across, and of course, may be really difficult to communicate to senior academicians who made these policies. And maybe with time, with more open access, with looking at environmental preservation and those kind of things, we might not want to actually print and we might want to only publish online. So there are several aspects that should really come into policies and academic culture. And academic culture itself should move from looking at maybe impact factors to the quality of research and to the peer reviews. Of course, of late, there are several journals that themselves publish the peer reviews, and they are quite good to read to understand the issues so that researchers can decide on whether they can use the article as evidence or not. Then, of course, organizations.
Dr. Rajesh Tandon here. May I request you to comment a little bit on these issues in light of the current COVID-19 pandemic situation before you close your presentation?
Yeah. Okay, so I will come to that in a little bit and going towards that. Of course, then we have mechanistic and skill standards, we have ethical and legalities and ownership of stewardship. So if we actually look at all these barriers and if we look at the current COVID pandemic, the question really is, in the COVID pandemic, we have open data, we have open publications, and we have open educational resources. So how can we, what are the challenges that we face when we look at these aspects? So we have all data that may not be sufficiently findable, accessible, interoperable, and actually reusable. And that may be a challenge or a barrier. So if we actually look at the Indian context and the Indian setting that we are in, not all hospitals actually have EMRs, that is electronic medical records. And it's really difficult to develop them at a short notice. To pool in the data is even further difficult. And that's the question of interoperability of data. And then, of course, there is the question of data sharing and how well each institution's policies permit that. So in the context of COVID, we've had these large issues of putting together COVID data and communicating data with the government and with several other organizations. Then, of course, we need consent to share personal health data and records. And the issue that we would have is what kind of data do we actually want from patients? What kind of data do we want to share? And do every institution's policies, again, have that, that kind of a consent? Or should we now introduce that consent every time a COVID patient comes to us, or a person who wants a test done or who's suspected to have COVID comes to us? So what exactly are the policies that govern individual data? Then, of course, we have differing definitions globally. And then to combine all this data becomes difficult. So who is really a suspect? What is the definition of a person who's been diagnosed? Who is a suspect? What are the different criteria to call a patient as a patient with suspected COVID-19? And what then? How then do we move towards, depending on the availability of various tests and the implementation of these tests, how do we really diagnose these patients? Label them as maybe coronavirus positive or different terminologies that have been used there. Then, of course, transparency of statistics that guide governments into policy making. The question is, are the amounts of tests that we've done applicable, sufficient to make decisions regarding quarantine and different other policies that are required in order to control the epidemic? And in order to do that, of course, we need transparent data, and they we really need to focus on. Because a lot of scientists have come together to sign the Open Forum Pledge to make data that is currently available in their settings free and accessible. Again, the question remains, will our governments and will national policies, who owns the data is probably the biggest challenge. In the current setting, we are uploading data constantly on apps, on ICMR apps, and on different kinds of apps. But do we, as the people who generate data, first get access to that data? Two, once we have submitted this data, what are the policies by these organizations to share this data? And I think these organizations who generated or who created these apps need to absolutely share these policies with us in order to understand what is happening and who can use and not use this data. What is the policy regarding sharing across borders is something else that we need to focus on. What could be the way forward? Of course, developing of data governance models for open research by default.
Dr. Rodriguez, may I request you to close now quickly because we have time constraint, please.
Yes, in a minute. Yeah. So the way forward would be perhaps to develop governance models, to have regulatory frameworks that enable interoperability between different institutions across borders, etc. Policies for reuse of privately held research data. What exactly can happen with it? How can we share it? May be important because not all organizations in the country are public. Securing adequate infrastructure, so we need maybe good electronic data systems and models that need to be set up. We need good human capital and institutional capabilities to set up these systems, and maybe not all institutions actually have this, and if we do have this, it might go a long way, or at least if we work towards creating these models. And then, of course, access to sensitive research data across borders on a more restricted basis in secure environments maybe is something that maybe governments need to review in the context of COVID-19 also. So with that, yeah, I thank you for again inviting me, and I'm sorry if I...
Thank you very much, Dr. Rodriguez. For all of you who are participating in this, we will be sharing all the PowerPoint presentations. We are also going to record, this is recorded. We'll put that up after a while. Dr. Rodriguez, would you remove your share screen, then we can move on. And, and we will also produce a short report, which we will share with you. Let me now invite Mr. Dinesh Sharma, who is our most well-known science communicator in the country and internationally acclaimed. Dinesh, your thoughts on the recommendations for science and science, but more particularly the question that both Pablo and Dr. Anand Krishnan have posed in terms of science communication during the pandemic.
Thank you, Rajesh, for inviting me for this very interesting discussion. Hope I'm audible. Yeah, so it's been nice to be a part of this panel and to know more about the UNESCO framework on science and scientific research. I must say that it's quite comprehensive and it perhaps covers everything on how science needs to be done in an ethical way in which it can connect the society and benefit the people. One of the points which struck me among the recommendations was need for science to interact with society and vice versa. I think from my point of view, from a communicator's point of view, this is one of the most important key elements of the several recommendations. Of course, there are several other points on which we can deliberate, but I'm going to concentrate mainly on this because it connects with communication. And I think we are holding this discussion at a very timely moment. One, of course, the pandemic is in the background. And the second important connection is that India right now is talking of a new science and technology, STI, Science, Technology and Innovation Policy. That process has been launched recently and discussions are going on. And I believe, I did participate in one of the opening webinars, and I believe science communication is going to be a part of this new policy framework which is emerging. So this whole UNESCO guidelines are going to be useful, and I am sure I would like the UNESCO Commission India to take note of this, both the STIP, the formulation of the new policy, and how this framework, some of these elements which are very relevant could be, dovetailed into the new policy. And I suppose this is going to be done. One of the most, intriguing fallout of this pandemic is something called infodemic, which Rajesh touched in the beginning. And it is so serious that WHO is right now thinking of classifying infodemic as a disease by itself. It's a threat to human health. I mean, can we imagine how information can be a threat to human health? We have reached such a stage. Not only now, I mean, this has been growing, but pandemic has kind of amplified this threat of infodemic. Basically, it means it has three elements: misinformation, disinformation, and fake news. So as we talk today, WHO is holding a fortnight-long conference on infodemiology, the epidemiology of infodemic, and what are its causes, how it can be prevented, what are the risk factors. So it's like a new disease that has emerged, and we need to wait for the outcome of this conference of WHO, and I'm sure we'll also have to develop a vaccine. So in that, science communicators like me and others are going to play a big role to develop a vaccine. So how do you immunize people against misinformation and disinformation? And this angle of infodemic has added a new responsibility on the shoulders of science communicators. We can go into the details of infodemic, but I'm not going to do that right now because that needs a whole workshop by itself, because it has its various causes and how to deal with it and how we and scientists can collaborate to do that. But having said that, context, I would say that another angle to look at currently is that the institution of media itself is under stress because the circulations are falling. And so on one hand, we have to deal with this deluge of information which is coming from so-called social media. In the sense, it is unedited, unverified, and inaccurate information which is flowing. And on the other hand, the sources which give out good information, which are supposed to have editorial control of what flows out and what people should be reading and seeing, they are under stress. So it is a double whammy when we come to see information flow. As we know, when jobs in media houses are lost, it is a science and health journalists who lose their jobs first, because in fact, on one hand, there is a dearth of science editors and health editors and health writers in India, and on the other hand, we are having this crisis. So, and if we talk about the institutions, if we talk about has infodemic affected how Indian people have received the information about the virus and how they have reacted, some empirical evidence is available. One recent study by Dr. Gohar Raza, which has been published in Journal of Scientific Temper, says that people have not sided. There is very little evidence to show that people have gone with what is being told to them on WhatsApp and what is being told to them in YouTube and what is coming as part of this deluge of information. By and large, Indian people have sided with evidence-based science. I mean, we are not seeing a movement on anti-mask movement like we are seeing in parts of America, or I have not seen people drinking cow urine on the streets of Delhi or anywhere. although some people propagated that, and it was part of that infodemic information just coming. So good thing is that by and large, there is a trust and faith which Indian people have shown in science. And I'm sure this is, we need more evidence, but whatever evidence we have in terms of surveys and in terms of perception shows that, people have gone with evidence-based information. People have sided with science, particularly in India. There is, and historically, India has not seen an anti-science movement. There have been groups here and there, but by and large, I mean, of course, there has been vaccine hesitancy in India in pockets, but we have not seen an anti-vaccine movement as we have seen in some of the Western countries. So this, I suppose, is a positive for health communication, is a positive for science communication. But having said that, I would also stress that we cannot sit idle on that. It is not a satisfactory situation. For example, if you take health communication, how many of us we know that there is a dedicated organization for health communication and health education in India? It's called the Central Health Education Bureau. I mean, it's been, as far as I know, Dr. Krishnan can correct me, they have been totally absent in when it comes to communication regarding this pandemic. Who is framing those messages? If you carefully analyze and do a content analysis of our messaging, somewhere we have gone wrong, and there have been official channels which have put out wrong messages. Of course, now the one benefit of social media is that you can name and shame them. People can call up and say then they have to correct it. So there has been a gap in communication. We have institutions, but we need to strengthen them. Maybe we need to revive, maybe we need to have new institutions. So then there is this gap of who communicates information when it comes to an event like a pandemic, which is science-led, in the sense which has a lot of scientific input and scientific information. As somebody said, it is 50% biomedical, 25% social, and 25% administrative or policy making. So, I mean, it matters. If you want people to have faith in science, it matters that scientists communicate. They do not go wrong. Scientists should communicate both to people at large and also to policy makers. And I think on both the fronts, we are lacking because we have never recognized communication as part of our institutional job in our science academies or science funding agencies or in big institutions like AIMS, I would say. So those structures, the institutional structures for science communication have been lacking, and that is showing now. Whatever communication is happening, thankfully it's going in a, by and large in a positive way, is a knee-jerk reaction to this pandemic and not as part of our institutions, like I mentioned about Central Health Bureau and Health Education Bureau and others. So we need to strengthen those institutions. Another point would be that, for example, I'll just illustrate in a minute this whole controversy about the vaccine. I see, as a science communicator and a science journalist, I see it as a failure of communication between scientists and the policymakers. I mean, there is no way, no science can tell you that a vaccine could be ready in 6 weeks. Last night, Dr. Soumya Swaminathan was giving the interviews, and she said it is minimum. Even if you fast track, it is going to take 18 months to 2 years. So how could the scientific community of this country, we have a full office of principal scientific advisor only to advise the government. How could an institution like the PSA or institution like ICMR, and there are several expert committees, has failed to communicate to policymakers that this is an infeasible thing. And even if we have a vaccine, is it the panacea? I mean, are we communicating right to the people, saying that, okay, we are just a few weeks away or even few months away from the vaccine, but is that going to solve our problems? No. So that onus falls on the shoulders of both the policymaker, I mean, both scientific community as well as science communicator, I would say, to communicate right, messaging to the policymakers so that people are not, because this thing doesn't have a cure or a treatment, so people are really looking for a vaccine. But is that right way to project that hope that vaccine is going to solve all our problems? So that is a collective, I think, responsibility of science journalists, science communicators and policymakers as well as scientific community to put it right way. I mean, Dr. Anand Krishnan mentioned about risk communication. We have no mechanism in our institutions to communicate risk. I mean, even in another context, there was this big issue with the nuclear power plant. It was the whole thing was created in Kodamkulam. That whole controversy and whole agitation was created because the nuclear power plant authorities could not communicate the risk to people in a proper way. They did a drill and people thought that something has happened. So, I mean, they could not even communicate this is a drill. You know, the whole agitation started after 20 years of the foundation of the nuclear power plant that, you know, something could go wrong. So there are issues where we need to build. One, of course, we need to build capacity in health journalism and science journalism in India. And our institutions need to build risk communication capacity and communication within the government. I think these are the 3-4 points. And that is the only way. I mean, that's one of the key components of connecting science to society and society to science. I think I'll stop here, and if there are further questions, we can take.
Thank you very much, Dinesh. As usual, you are on top of it, and your vaccine example is most profound, very clear. Okay, no. Now we are going to open it up. We have some time for question and answers. Some of you have been kind enough to already write the questions, and I think I would encourage our panelists to take a look at them, and I'll invite them in a while. But if any one of you want to make a comment and all, you can also raise your hands. I noticed that there are a couple of people who have asked this question as well from us, that, you know, Dr. Priyadarshini, who has raised this question, she supported this point about science and technology policy initiative that Dinesh and Rashmi had also mentioned. So I would ask Priyadarshini, if you are there, you want to say something about it, please.
Yeah, hi. Can you hear me?
Yes.
Okay, so my question was related to the science policy that is being drafted. Dinesh made a comment on that. It's being drafted on the tenets of being evidence-driven, thematic, and bottom-up. The communication of science in this country, on the other hand, that Dinesh also alluded to with examples, do not really follow most of these tenets as of now. So my question basically is, how are the recommendations that the national recommendations that go into feeding this, how are they going to portray this paradox, and whether we really take ground reality as the summary or something that the government feeds into the policy as the summary?
Thank you. Very, very clear. We'll come back to that in a minute. I noticed that Dr. Bhaskar Balakrishnan from Science Diplomacy Fellow, RIS, was there. Are you there, Dr. Balakrishnan? Would you like to make a comment or two? Jigme, is Dr. Balakrishnan there? He was there. Oh, he's not there anymore. Okay, thank you very much. Vasanti from Center for Media Studies. Vasanti, you have been very active in educating the media and being a link between the world of science and media. Are you there? Would you like to make a comment? Is Vasanti there? I saw her earlier. Oh, okay, she's also not there. Okay, now from WHO, I noticed that Dr. Loharia is there. Is Dr. Loharia, are you there? Would you like to make a comment or two? All right, you don't have to make a comment. It's not compulsory. I'm just asking if you want to share some reflection. I wonder if Dr. Panda is there from ICMR, who has been responsible for a lot of this work. Dr. Samiran Panda, would you share your reflections on the recommendations arising out of UNESCO and this whole interaction of science and society, and the possibility of including all this perspective in as the country moves forward in framing the science and technology innovation policy. Dr. Panda, please.
Good afternoon, Dr. Rajesh Tandon. Can you hear me?
Yes, we can hear you, Dr. Panda. Please go ahead.
All right. Thank you. First of all, thank you for inviting me to join this webinar. And this was really a very pleasant experience listening to Pablo and Dr. Anand Krishnan and other speakers, Mr. Dinesh. I am from ICMR, and probably it's much better if I speak the less, because ICMR over the last 2 months has moved through the waves of communication, meaning at times it was at the top, and then for certain communications it was not really at the helm of affairs. By listening to Pablo, while I really liked when he said that science generating evidence leading to truth, or some semblance of truth that comes out, and then that contributing to democracy. And while listening to that, I was thinking of is there a truth which is one piece? Or does we get to know the truth in increments? Because as a practitioner of science, I realized, why did I like this whole thing? And thanks again, Dr. Tandon, because this communicating science, by knowing the science of communication, there's a science behind communication. How do you communicate is very important. And if the science of communication is not followed, then communicating science could go wrong. The point I'm trying to make here is that, and I really liked the way Mr. Dinesh said, infodemics and infodemiology. So if information done in the wrong way and the deluge of it, if it takes a disease proportion or epidemic proportion, then why do I like this? In disease scenario, we also have physicians who manage things when it's not an outbreak situation. But the outbreak situation management or emergency management requires a special skill. So I would say that in an institution like ICMR or any other organization, one could have a defined skilled set of people who would be involved in regularly communicating science, but the same set might not have the skill that would be required during an outbreak or epidemic or a pandemic situation. That's why I liked when Mr. Dinesh talked about infodemics and infodemiology. In terms of Dr. Anand Krishnan's expression of truth and how things could go wrong, and particularly this whole issue around the population-based information that gets generated, and then helping people to think how much of it is relevant to individual level risk. That's what I liked. So actually it happened yesterday, and I had to respond to a journalist who was asking me about this whole WHO vis-a-vis the evidence generated by other group of scientists and transmission of SARS-CoV-2, either by air or through water droplets. What I would say, while communicating science or scientific information, it's very important for us to know that if it is going to the public domain, how do we avoid creating panic while communicating an information? Sometimes it might be a very pleasant experience for scientists to vociferously, talk about the evidence that they have generated. But we should also probably think in terms of how do we present it so that the relevance to an individual in terms of his or her risk of occurring infection is conveyed. So in brief, I would say that knowing the science of communication while communicating science is very important, and it probably demands knowing the science of communication in a situation where there is no pressure in terms of having a pandemic or managing an outbreak or managing a serious situation vis-a-vis the regular research that is going on and the evidence is getting generated. And second point that I want to make is that the order of biomedical research is such that truth is never known or attained in one go. So it comes in increments, and it so happens that we do change stands. That's okay. And when Mr. Dinesh said, I am completely in agreement with it, that Indian public per se, or as such, in majority, they are quite, open to this idea, because this has been a country of seekers. Although we do see believers at times, but we are known to seek what truth is, and in the process of seeking truth, sometimes evidence would be generated which may need to be relooked into or re-examined, and it's good so long as another piece of information or base of information doesn't challenge it and refute it. So and people are quite in a position to be able to understand that the practice of science is such, or seeking truth, the discourse is such that it never talks about a sacrosanct piece of information. Lastly, I would say that the program planners and the policymakers, when you say, okay, this is the evidence, this is the truth, and that's how the program and the policy is being formulated, I would end by saying that in public health practices where it involves health and disease, the policy and the program also is not carved in stone. It needs to be re-examined, revisited again and again in the light of new evidence that gets generated, and the communication around it should also happen. Thank you.
Thank you very much, Dr. Panda. Very, very helpful, thoughtful comments. We are reaching the end of the time that we had allocated, but I want to invite Juan Pablo. He wanted to make a brief comment, and perhaps if Dinesh or Dr. Anand Krishnan or anybody wants to make a quick comment. Juan Pablo.
Yes, thank you so very much. I will just have to say that it's really a privilege to have heard to such beautiful insights and thoughts by all of the speakers today. And I just wanted to make 2 points. Of course, the recommendation, I have to recall that this is an international legal instrument. And the key word is instrument, because of course that entails that it can be used by not only governments, but also all of those concerned by that instrument. And of course, the second point to make is that this type of instruments, while adopting them, they become an obligation for governments. So it's very important to consider that this type of standard is something that needs to be implemented, and that we can all, even the government, within the government, we can all say that we have to implement. Just a point on the implementation of international comparisons. Of course, I just simply have to agree with you, Dr. Krishnan, that and I think, I don't know if I said comparison, but I was careful to say that this is all about knowledge sharing. And the reports establish a baseline, and then what we can do is compare the country itself in its evolution across the time. As you say, within the country, of course, those comparisons are very valuable, but mostly, and as the nature of science itself in our globalized world, and even before the globalized world, there's a lot of knowledge sharing that can come on the way we approach science, we implement it, and we address what may be common challenges, even if, of course, the value of each context is extremely important. And just a final note on the importance of when we talk about human rights, and again, we are talking about science internationally recognized as a human right. On the one hand, there's the issue of protection that is, as everyone has been saying, on all of us coming together to see how we can accomplish these noble objectives and necessary objectives, but also the issue of promotion. And that is where I cannot but agree with all that has been said in terms of communication. And that brings me actually to, because I mean, promotion is of course important, because how can right holders know that they are the holders of a right if it has not been promoted, you know, like, because that's how human rights promotion nature works. And that brings me to the final point that was in the Q&A section of how to bridge the gap between research and then policy making. Because of course, when Samir Anser was saying that is truth something or pieces, the nature of research is of course that we approach by pieces to truth, no? But when something coming from science becomes truth, or something coming from other considerations become truth, when it's policy, when it's in a policy document, sorry, but that's structural, and that will be what will guide us at least for some years until the context changes. So that is why UNESCO particularly promotes the issue of bridging the gap between research and policy making. That dialogue also needs to be enhanced. It's a very important nexus to be able to respond to these challenges, and that is also embedded in the recommendation. Sorry for taking too long, and thank you very much.
Thank you, Juan Pablo. Thank you. Dr. Anand Krishnan, you have any quick closing comments?
Just two comments. One is that if you want to promote science and science communication, as I said, and we need institutional mechanisms which are very weak. We need clear roles and responsibilities for these institutions. Right now, for that, we don't know what is ICMR's role, or NCDC or CHEB's role in this. We need clear rules and responsibility, and they should have capacity. Many of them simply do not have the capacity. Like CHEB simply lacks the capacity to handle a matter like this. There's no point in saying that they are not being involved. They don't have capacity. And last point, and perhaps the point most important, and it's also there in the Q&A, and this is what when I started as a researcher, I used to research on community. I think while we are looking at science and policymakers, the other extreme is science and public or community. And something that I learned working with Dr. Tandon, I'm still learning. I'm moving from working on communities to working with communities with the help of people like Dr. Tandon. And I think that is what has to be there. The people and have to be at the center of science, and we have to do science with them, and communication will automatically happen on that. On that note, I will take leave. Thank you.
Thank you very much, Dr. Anand Krishnan. Dinesh, you have any? Yeah, please.
Point which Shubhra also raised, and it was raised earlier also, about how do you integrate communication into science and technology policy. But here, as I could not amplify the difference between science communication and science journalism. See, on papers, all the policymakers would like to promote science and health communication because they think it is a neutral entity. Because science communication is what? Explaining people how science works, how a vaccine works, how antibodies are produced, you know, how it affects, gives you good health. But whereas the job of a science journalist would be to raise questions of accountability and transparency. Because policymakers, the governments will always be comfortable with communication. Right now, they're not even with communication. But plain, simple communication will not help. We'll have to include elements of transparency and accountability. Otherwise, communication is good, but it is not a complete, it may not help at the outcomes which we are looking at. And also the involvement of community, which Dr. Krishnan pointed out. And, you know, this whole concept of bottom up, you know, how do you look at people who are doing science outside the formal system, which Dr. Tandon has worked, and Dr. Anil Gupta of NIF is working a lot. So, I mean, there's a whole lot of science, so there's a whole lot of ideas, innovation happening outside the formal institution. So let's not forget the informal sector, the informal, stakeholders in this whole game, and differentiate between science communication and science journalism. We need to have both, I would say, and the policy should take care of both, because policymakers are all, because why are we having such a weak, ambivalent attitude towards science communication? Because science communication would lead to questions of transparency and accountability, which is what policymakers, governments, and politicians don't like.
Thank you. Dr. Rodriguez, do you have any quick comment? Okay, well then I'm going to just say a few words because this has been very stimulating for me, and thank you all panelists and Juan Pablo and Dr. Panda and Shubhra and others who have made comments, including in writing. You know, I'm working with a number of UNESCO chairs around the world on preparing a presentation called Open Science. And the subtitle is Open Science Beyond Open Access. Because open access is one scientist to another scientist. And even the draft scientific social responsibility policy, which was released in January during the Indian Science Congress by Department of Science and Technology, only talks about what Dinesh said, science communication, telling public what scientists want to tell, or scientist to scientist communication. We don't need scientists to come and do tree plantation in the community. We are a country where multiple systems of knowledge have existed historically. And it is not just the informal part of the science that is going on. We are a country where people's science movements have been there for a long time. And that's why it's not surprising what Dinesh said or what Dr. Panda also suggested, that it's not people are revolting against science, but scientists are busy communicating only with scientists. That is important. But if we want science interaction with society, if we want science to be trusted, if we want scientific policies built on science, scientific evidence to be accepted and owned by society, then science has to work with society. And the scientific social responsibility policy draft ignores that currently. I hope when we move towards preparing more bottom-up process of science and technology policy in India now, science and technology innovation policy, as we move forward, we make it more inclusive consultation. We bring in people whose body of knowledge may not be tested in the lab, but is tested in the real world. You know, why do we go back to our tribal community and value indigenous knowledge when we need to look after trees, we need to look after water sources? Last year in June, after taking over the second term, Honorable Prime Minister appealed to everybody saying, we want traditional indigenous water harvesting sources, because water cannot be only piped water for the entire population in India. And those water harvesting technologies, that science has been in existence. It's just not the science which is taught in Department of Hydrology in Indian Institute of Technology, Kanpur, from where I graduated 45 years ago. So the point that I want to make is that in moving forward with the recommendations that UNESCO has been coming forward, let our scientific community, let people like Dr. Panda, like people like Dinesh and Dr. Anand Krishnan and Rashmi and many of us who may not be working inside a lab or who may not be working inside a government lab, but who have an approach to working with science and bring them together in developing a more holistic and purposeful approach towards science, science communication, science journalism, science policy, and building the interlinkage. I am glad that Dinesh pointed out that there is a Central Health Education Bureau. I did some work with them 38 years ago, I just remembered, on occupational health and safety when I was working on workers' health. They should have been at the forefront of the communication. Imagine the foresight of a earlier decision maker that they created this center. But today, that center perhaps doesn't even have technologies to deal with the population which plays around on mobile. Maybe they are used to the poster model as yet. So if we don't have capacities, they won't be able to play a role. And we have centers like this in institutions, in universities, in research centers, but they need to be capacitated. And this relationship needs to be viewed a bit more, what I can say, positively, as opposed to keeping society outside science and scientists prioritizing research and doing research without any relevance. I don't think this country we should be proud of the fact that our constitution talks about scientific temper, and that many people in our leadership, in our political leadership, in our societal leadership, have used evidence as a process of building democracy, as Juan Pablo talked about. So I want to suggest to you all that let us figure out a way by which, in preparation for March 31, we involve Juan Pablo and UNESCO and ICMR and DST and everybody who can play a role, our science communicators, our community leaders at large, so that we come up with a robust approach to this work. This pandemic may go away, but as societies become complex, we need to find ways to be able to support, draw evidence, draw lessons, but also communicate and support each other. The pandemic that Dinesh pointed out about infodemia, that pandemic is a result of the WhatsApp community, which is throwing all kinds of information and distorting understanding. It is within this framework that we need to now engage people, because once the tool is available, it's like a knife. A whole bunch of people running around using knife, but to what end? Chopping a mango or cutting a finger? And I think this is where we can't stop using the knife, but we have to work with people to figure out how do you use it properly to cut a mango and enjoy it. So thank you all, thank you very much. But open science and science with society is the way forward, and we should be proud of the fact that we have strong scientists, like many of you in this community, strong science institutions, strong investment in science. We need to take the next step and make science with society, not just science for society. Thank you all. Thank you to the panelists. Thank you, everybody. It's been a wonderful conversation. We will share the recording. We'll share a brief report, and we hope to work together as all of you and many others who may not be able to join today to take forward this process. Special word of thanks to everybody. Be well and stay well.
Thank you.
Thank you. Thank you, Juan Pablo. Thank you, everybody.
Thank you all. Have a nice day. Bye.
Thank you, Rashmi. Thank you.